If you're a hand therapist, one of the worst cases are stiff hands, multiple surgeries, that chronic pain and stiffness that you struggle to make improvements, keep improvements. If that sounds like you and you've had these kind of cases, me too. Here is a video that I'm going to share with you of someone that I was working, had multiple flexor tendon lacerations, and he had trigger finger releases and a tenolysis, you name it. It was chronic, lots of scars. I'm going to share with you some techniques. Check it out. This is a case, stiff hand, multiple tenolysis, carpal tunnel, trigger finger, chronic, right? So because he has a lot of that pisiform pain right here, and his whole hand is just a hot mess, is the way I describe it. He's got extrinsic tightness coming down, and then his tendons are very adhered, and he's developing a lot of tendonitis types of issues where he can't move his wrist very well. Chronic issues always end up having internal rotation types of issues. So one of the things I did was every time I work with him, if he's really painful, I'll do some prone on elbows, I'll stretch him, I'll see how his internal and external rotation is. I'll do isometrics. So usually I test extrinsic, intrinsic, which direction feels the easiest or the better direction. The majority of the time it's going to be, intrinsic rotation. So I did a few of those with him, and then I wanted to show you what I'm doing with his hand. Once I can get him a little bit less painful, let me check his shoulder. So we couldn't bring him down that much. Mira, tú puedes toque. Yeah, mejor. Right, okay, so that wasn't the point of this. The point of this one is if you take a look at his scar, I'll put it here. He's got a lot of scars right here. You can see this indentation and his scarring. He's got all this palmar. So here's your pisiform, and it's really, you can scrunch it up. Put the wrist in a little bit of flexion, and you could take it and you could feel it. It's adhered right here, right? So one of the things that you could do to kind of loosen someone up is you're going into that ulnar deviation, radial deviation, right? So if you take this pisiform and you push it radially while the wrist goes ulnarly, I can get some scar movements here, right? But it's getting the wrist loose, right? So I'll do that one, but what's better than just straight ulnar radial deviation is using the dart thrower's position. The dart thrower's position gets you radially deviated, but with some wrist extension, right? So where the crease of the wrist is, I'll put my finger and I'll have my thumb where their thumb is, right? And then I'll move them into slight wrist extension and radial deviation. And then when I come here, I'll have my thumb on the pisiform and I'll have them go into slight ulnar deviation, right? And slight wrist flexion. Now that's all great and dandy, it feels okay, but here's where I like to get a little bit more technical. So actually we'll put my fingers, right, like this, in between the fingers, so I can hold on to these two metacarpals better. So you could do it like this, or you can do it like this, so whatever feels comfortable, right? So then I'm going to take and really take the metacarpals, push them into that wrist extension radial deviation, and then I can come into ulnar. So I can have better, essentially, control of the metacarpals and move better. So he didn't have this much motion before, and now he has tons of motion, right? Mejor, right? And I should actually measure. And so you could do this motion just to get the wrist loose. You can still hold on to it. Abre los dedos, cierra. So I'm trying to get more hook because I want his flexor superficialis and profundus to move and stretch out the intrinsic at the same time because he's stuck in the middle. He's like this. Vamos, vamos, ale. Sigue. Right? And you just, I always like to think of ways in which I can control the hand better. And then it's not that hard for me. So with this hand, sigue, I am controlling his wrist so he doesn't pull down. Y'all, people know that when someone can't make a fist, they start pulling down with their wrist. This allows me to control wrist motion. My fingers hooked in like that allows me to control MPs from pulling down, and he's really, and then I can use my hand to assist. Right? See? And then relax, relax. So when you encourage someone to make a fist, I always say, relax the wrist, relájase la muñeca, relájase aquí y mueva los uños para abajo. So that's how I teach my people to make a fist if they're chronic. So you want them to relájase todos, right? You want, so he keeps pulling. Stop it, stop it. Right, you want the wrist, everything to be very relaxed. The wrist to come back, and then I always say drop it like it's hot. Right, the MPs come down, and then you just gently pull in from the nails. Right, relájese. So every single time, if you have to readjust, it's better to have better form than and readjust in between. So he's squeezing with his whole body, right? Desde todo el cuerpo. All right, relax, right? So we want the wrist to be in slight extension, the MPs to come down just gently, and then just relájase y mueva los dedos, those like the nails. And you could do place and hold too, because he's pulling with all his might. Relájase. Relájase así. Okay, ahora apriete muy suave. Suave. Alright, relájase. Relax. Relax. Apriete suavecito. With your nails, right? Think about your nails. Right? Relax, relax. Because you can feel it when they start scrunching. So they start scrunching their intrinsics while they're pulling. And what's happening is they've lost not only the steps, but the rhythm. So if you're trying to dance, you learn the dance steps, right? And then when you get better, you put the dance steps with the music, so you have rhythm and you'll look like you know what you're doing. Same with the hand, right? So he's lost both the steps and the rhythm, and you're trying to teach. You have to reteach how the hand is supposed to move, right? Relájase. Mira la mano. Mira, relájase la muñeca. Relájase los dedos aquí. Relájase todo. Y mueva los uños para abajo. Mira. Suave, apriete, suavecito. So he's pulling from here, but he's not pulling from the tendons. Relax, relax, relax. Apriete muy suave, muy suave. Hey, there you go. Right? It's hard because he cut his tendons, and once he cut his tendons, yeah, he hasn't been using them. Right, multiple surgeries later, we got a stuck hand. All right, so try those things out and let me know. There's a ton of things to unpack in that video, I know, but if you want to know why some of that works, how some of that can work to help your patients who have chronic and stiff hand and wrist issues, well, I'm going to include the link below on different ways in which you can work with me. I've got live in-person courses, I've got online manual therapy courses, as well as mentorship programs. All the links below. Let me know what kind of help you need.